Hello, everyone, and thank you for joining the Kansas Health Foundation's webinar on the Recognition Grants Program. My name is Shawn Brown, and I'm a program officer here at the Foundation. And what I thought we'd do today is just provide a quick overview of the program. And then on a separate webinar, my colleague, Elisa Buller, who is our grants officer, will walk you through the online application. That webinar will also be posted on our website, so please be sure to listen to both. Because our call today is pre-recorded, there isn't a questions and answer segment at the end, but you can find a written Q&A on our website, and you can always reach out to me if there's something that we haven't covered that you have a question about. So let's get started. If you have a great proposal idea for a healthier Kansas and you've been wondering about how to best craft a proposal for your organization or about the review process once it's submitted, today's webinar will give you some key points to consider as you prepare your proposal and help you understand what the technical committee is looking for when they review the proposals. Now, some of you may be very familiar with the Recognition Grants Program, but for those of you who are not, I'd like to provide just a little background on the Recognition Grants Program. It was developed in 1994 to provide an opportunity for nonprofit organizations to submit unsolicited requests that fit within the mission of the Foundation, which is to improve the health of all Kansans. And since 1994, the Foundation has funded a little over 1,500 grants, totaling almost $20 million. Now, these grants range from as low as $500 to the maximum amount of $25,000, with the average amount being right around $13,000. The recognition grants are funded at the maximum of $25,000 per calendar year per organization. And using a competitive process, the Foundation awards up to $2 million annually, and the application deadlines are March 15th and September 15th. Now, this is a responsive strategy for the Foundation to support a broad range of health-related organizations throughout the state. And paramount to this strategy is our desire to remain connected to ongoing health concerns and program innovations developed throughout Kansas. So again, we welcome your new ideas and look forward to providing support for meaningful and charitable projects that fit within the Foundation's mission. Now, in addition to supporting projects, the Foundation also seeks to support initiatives that focus on promoting policy, systems, and environmental transformations that support health. So these PSE initiatives, as they are called, that affect all aspects of health, including social factors that contribute to a healthy population, may be considered. So, and funding may be used to support activities of the proposed initiatives, such as strategic communication. You know, if you are addressing a policy issue and you need to educate and mobilize your community regarding the issue. It may be coalition building or data collection to inform or support an initiative. Or there may be a focus on non-lobbying advocacy actions. Now, the idea isn't that these are funded as isolated activities, but as part of the overall effort. And all of these may be included in your proposal, and I'll talk a little bit more about that in detail. But first, I'd like to illustrate the differences between projects, programs, and policy initiatives, all of which are acceptable. And an example of a project might be you're requesting funds to purchase computer equipment. And once installation of the computers is finished, that project is complete and you've accomplished your objectives. Now, with a program, you may be providing ongoing services to a community, such as providing meals or taking people for doctor's appointments or a jobs training program. With a policy initiative, you're looking at promoting or instituting comprehensive, adaptive solutions at a broader level. So by effectively educating and mobilizing the public, educating government policymakers, or advocating with organizational decision makers, a nonprofit can support policy, systems, and environmental change. Now, some examples of policy initiatives might be addressing smoke-free multi-unit housing. Your organization may educate apartment owners on the benefits of implementing smoke-free policies. And through this effort, you're impacting a larger number of people and changing the type of housing options that are available. Another example might be addressing smart growth and development policies with business owners. So perhaps your organization's mission is to aid in the revitalization of a downtown area in your community. So you're bringing coalitions together to address that challenge. Or perhaps you want to educate small business owners on the benefits of healthy lifestyles for employees, and you may assist them in looking at what their policies are regarding vending or what types of food are being provided during the workday. So these are all examples that are solely for illustrative purposes to demonstrate the types of grants that are possible. So through supporting projects, programs, and policy initiatives, all of which are acceptable, it helps us achieve our mission. Now, to understand the Foundation's mission, it's helpful to know how we define health. We join with the World Health Organization in believing that health is a state of complete physical, mental, and social well-being. And it's not just the mere absence of disease or infirmity. We cannot meet this mission without a broad network of effective partnerships across the state. So we work closely with other health foundations, nonprofit groups, community foundations, state agencies, universities, hospitals, to develop programs and find answers to complex health issues. So we really value your partnership in helping us achieve this mission. In addition to financial support, we also seek to make an investment in a nonprofit organization's development. So I'll talk a little bit about the conference. We've been hosting a recognition grant conference since 2002 for recipients to provide professional and personal development and networking opportunities. So our next conference will be on April 6th and 7th in 2017, and it's designed to provide information and resources to support your efforts and allow you to connect with other nonprofits throughout the state. And we're going to offer, several skill building workshops that range from an overview of strategic communication planning to volunteer management, leadership, fundraising, and donor development and board development, just a variety of breakout sessions. So the conference is open to all applicants who apply in 2015 and 2016. And there'll be more details regarding the 2017 conference as that date approaches. But because applicants from multiple years are being invited, we do suggest that you register early to assure that you're able to attend the sessions that you want. At this point, I'd like to draw your attention to ineligible projects. The list on your screen is also on our website, and regarding the funding that it would be considered ineligible. And one would be medical research, direct medical services, and we've also added video games and systems. All of those would not be eligible. Also, please note that playground equipment, building a playground or a trail is also considered construction, and so these types of projects are not being funded. Regarding lobbying, by that we mean lobbying on the introduction, enactment, or amendment of specific legislation and activities supporting candidates of political campaigns. And the specific IRS codes are listed on the website. So for more information, please take a look there. Now, I'd like to clarify that you can advocate for policy change with organizational decision makers. You can educate government policymakers, and you can participate in community mobilization and community education as we described earlier. So again, please take the time to review this list before preparing your proposal. I'd also like to talk a little bit about the review process, what it looks like, and who are the individuals that make up the review committee. The committee is an independent group of reviewers made up of Kansans from all walks of life who have the responsibility to evaluate all of the grant applications received each cycle. And they may range from coaches to public health officials, teachers, nonprofit executive directors, in short, individuals with a broad knowledge of the field who have done the work and recognize the challenges found within the nonprofit sector. So what's more, they hail from many different areas of the state, providing a greater depth of knowledge for each of the geographic regions of the state. Now, there are many factors and questions that the review committee considers when deciding which applications will be funded. The Technical Review Committee is looking at the overall strengths and or weaknesses of the proposal and examines the feasibility, sustainability, and likelihood of success of what's being proposed. So some typical questions to consider as you're preparing your proposal are noted here, and you'll find a more comprehensive list on our website. But the first being, does this proposal address a significant community health problem that is defined in a clear and compelling way? Do you make your case with the data? Do you outline why you're uniquely positioned to do the project or the program? For example, you may be an organization that helps low-income parents with skills to prepare children for school. Well, are you making a compelling case in terms of the data? For example, you may say that 95% of those enrolled in the program completed the program, and 88% of the children whose parents participated in the program demonstrated a 40% increase in school readiness. And now, 90% of the parents surveyed who completed the program would recommend it to a friend. Are you making that kind of case with data? Are you describing why you are uniquely positioned to address the issue? Does the applicant organization have the capacity to carry out the project's activities and to achieve the defined outcomes? What the Technical Review Committee is looking at is, does the organization demonstrate a history of carrying out this work over a period of time, or in some cases, is this a new idea that you may be proposing? So do you have some data on the best practices regarding the idea? Or if it's something truly innovative, how likely is it that the venture will be successful? So they'll be weighing those types of items and taking that into consideration. Also looking at what's the capacity of the staff. Does the lead agency have a history of working well with other organizations in the community? Does the community itself have a history of cooperative and collaborative efforts among schools and health organizations and social service agencies? If funded, will the proposal increase the organization's capacity to do their work? So the Technical Review Committee will be looking at those types of capacity indicators. Now, if you're an organization that's been doing the same type of work for a number of years, you'll want to be able to demonstrate the types of outcomes you've achieved. So if you've previously received 2 grants from the foundation and you're requesting funding for a 3rd time, having the data to back up your past performance and why you're requesting funding again will be helpful to your case. So think about, what tangible data can you provide that demonstrates the success of your project, program, or policy initiative. For example, if you operate a jobs training program, providing data such as, last year we had 200 participants enroll in the program, and out of those 200 participants, 90% of them completed the program in 6 months, or 80% gained employment within 3 months of completing the program. That type of data will have a much greater impact as you tell the story of what you've accomplished rather than just stating participants that they appreciated the program. Another thing that the committee looks at is, are the outcomes of the project clear, measurable, and reasonable? For example, are you describing the number of people you want to impact, and is that reasonable for the amount of dollars you've requested? Are you describing the percentage change you want to see, for example? We anticipate that 95% of participants will complete the 6-month training program by June 30th. Have you used SMART objectives and activities in describing the work that are specific, measurable, attainable, achievable, relevant, and time-bound? Another thing I want to point out is that when you're preparing your proposal, to avoid the trap of there being gaps in what you're describing, sometimes when you're intimately familiar with the work you do, there may be the assumption that the reviewers know how you're going to accomplish the work. So it's helpful to be specific and address what exactly are you going to do and for whom, and what's going to be the change in the population or as a result of a policy being instituted, and what are the specific actions that will result. Now, there's a lot of good information on SMART objectives, and you can find additional information on that on our website, so I won't go into more detail. Another thing that's considered is looking at the budget. Is it appropriate for the planned activities? Are you asking $25,000 for a project that will impact 20 people, or will it address the needs of 350 people? And is the total amount of the project being requested from the foundation? And if you are requesting part of the funding from the foundation, what commitment level do you have from other sources? So if you don't get all the funding, do you have a contingency plan? We've also modified a couple of questions to the application that are raised when proposals involve minors. And so if your proposal requires adult volunteers or paid staff to interact with minors, will you perform background checks on those service providers? And if so, are you requesting all or a portion of those costs to be funded by the grant? Also, if your proposal requires adult service providers to interact with minors, have you provided a copy of that background policy? So please make note of those questions and be sure to attach the policy in your application. Lastly, the committee looks at how does your project rank when compared with other applications received during the cycle. It's a very competitive process. Your proposal is not only being compared across the state, but you're also being compared to other organizations that are doing similar or the same work as you. So the committee takes into account a broad range of factors. Again, as I mentioned earlier, we welcome new ideas and look forward to receiving your proposals. So in summary, if you've painted a compelling picture about the policy issue, project, or program, if you've demonstrated your data with past successes, and if you've described clearly the outcomes you anticipate achieving, you'll be well on the way to crafting a strong proposal. Thank you for joining today, and if you have any questions about the application when you're logging in or any technical issues with uploading the application, please contact Blair Weibert. And if you have any questions that are of a programmatic nature and you can't find the answer on our website, please don't hesitate to contact me directly. I wish you the best with your submission, and thank you so much.